News Channel 3 is your back-to-school headquarters. A message for parents tonight to protect children from viruses.
Flu season is approaching and COVID is still circulating out there. This comes with conflicting guidance between the FDA and other health organizations when it comes to COVID vaccines. News Channel 3's Timothy Foster live in studio after speaking with school officials with some health recommendations for families. Timothy.
That's right, John and Karen. It's called the Stratus variant of COVID-19, and it's seeing an increase in Southern California. When it comes to the flu, experts say it's still too early to make predictions about how severe this year's strain will be. I visited a local school district and talked to local health professionals about what you need to know to keep your students safe.
Implement good hand washing measures, both in the classroom and at home.
Keeping students healthy and happy. Laura Dyson is the Director of Health Services for the Palm Springs Unified School District. She says they follow the guidelines set in place from the State Health Department. Here's what you need to know. COVID vaccines used to be available to anyone 6 months or older regardless of their health, but with the current administration, that's no longer the case. The FDA now limits updated shots to those 65 or older and those including children with serious health conditions. On the other hand, for flu shots, the CDC says everyone 6 months or older should get a flu vaccine. These are rare exceptions. Dyson says most students can attend class even with mild symptoms, but a fever, vomiting, or a contagious rash means they should probably stay home. And for students who test positive for COVID-19 can return to school as long as they are fever-free.
COVID's really treated just like any other respiratory disease now, so really what we're looking for is for students to be feeling better overall, well enough to come to school and learn, and if they're not feeling well enough to come to school and learn, then we do encourage them to stay home.
Doctors also say it could be tough to tell the difference between a common cold, the flu, and COVID. Lindsay Valenzuela with Desert Oasis Healthcare recommends testing when possible, especially for those at high risk.
Testing helps because for some people who are at high risk, it allows them the opportunity to be treated early for either COVID and the flu, and those treatments are different. So that's when testing might be really beneficial. If you don't plan to test and you aren't really concerned with a high-risk condition, the rule of thumb is really waiting until 24 hours after that fever breaks without medication.
Families can also take advantage of local resources provided by the school, including mobile clinics offering care for flu and cold-like symptoms, often at low or no cost. Nice. Valenzuela also urges good hygiene and vaccination as key tools this season.
I know that lots of teachers really focus on sanitation, hand washing, and those are the things that we can do as a community to help avoid outbreaks.
And to be clear, there are noticeable differences between new federal regulations on COVID and recommendations for some medical organizations. The American Academy of Pediatrics strongly recommends the latest updated COVID vaccine for all infants 6 to 23 months, not just those who have high risk. For a list of mobile vaccine clinics in your area, just head to our website, kesq.com. Reporting live in studio, Timothy Foster, News Channel 3.